Okay, today we're going to be doing a exam of the chest and the lungs. We're going to start off with a recollection of the past medical history and proceed with a physical examination of the patient. Do you have any history of a cough or sputum production?
No.
Any associated symptoms such as shortness of breath, chest pain, or chest tightness?
No.
Any complications or complaints of difficulty of breathing?
No.
Any fever or nasal congestion?
No.
Any noisy respirations, hoarseness, or gagging?
No.
Any history of thoracic, nasal, or pharyngeal trauma or surgery?
No.
Any hospitalizations for any pulmonary disorders?
No.
Do you use oxygen at home?
No.
Any use of ventilation-assisted devices, including CPAP or BiPAP?
No.
Any snoring?
No.
Waking at night or trouble sleeping or extreme fatigue during the day?
No.
Any chronic pulmonary disease such as tuberculosis or bronchitis?
No.
Have you ever been tested for tuberculosis?
Yes.
Was that negative?
Yes.
Any history of emphysema, bronchiectasis, asthma, or cystic fibrosis?
No.
Any allergy testing for seasonal allergies?
No.
Allergies ever affecting your breathing?
No.
Any congestion or nasal drainage?
No.
And type of employment?
Truck driver?
Do you have any exposure to environmental hazards?
Occasionally, yes.
Any exposure to chemicals, inhalants, vapors, dust, animal dander?
Dust and animal dander.
You have 2 pets at home, correct?
Yes.
And you have exposure to hazards at work?
Yes.
Any pulmonary irritants such as asbestos?
No.
Do you use any type of personal protective equipment at work to reduce your exposure?
No.
Does your work provide you with any type of personal protective equipment?
Yes.
And home environment, you live in a rural community, so you don't have any exposure to factories or heavy highway traffic or community traffic such as trains or buses?
No.
Any possible allergens within your home for mold?
No.
Any type of heating?
Hot water baseboard?
Do you use any type of air conditioning, such as central or window units?
Yes. Central air?
Okay. Do you use a humidifier or any ventilation type of system?
No.
Is your home equipped with a working smoke detector?
Yes.
How about a carbon monoxide detector?
Yes.
Are they both working?
Yes.
And how many do you have?
4.
Do you currently use any type of tobacco products?
No.
Have you ever used tobacco products in the past?
Yes.
And what type of tobacco product did you use?
Smoke cigarettes?
And what age did you start smoking?
Age 11.
And for how many years did you smoke?
30.
30. And about how many cigarettes or packs a day did you use?
Between a pack and a half a day.
Do you have any exposure to secondhand smoke currently?
No.
Did you experience exposure to secondhand smoke as a child?
Yes.
Do you use any type of rescue inhalers, nebulizer treatment?
No.
Any history of wheezing, trouble breathing with exercise?
No.
And you're able to meet your activities of daily living without any increased shortness of breath or difficulty?
Yes.
Any history of burns to your face or your neck?
No.
Any history of any type of inhalation or smoke burns?
No.
Any difficulty swallowing?
No.
Frequent coughing with drinking?
No.
Have you ever been diagnosed with aspiration?
No.
Have you ever been diagnosed with pneumonia?
No.
Any restrictions for your dietary intake, such as thickened liquids or pureed foods based on swallowing or drinking?
No.
Okay. Next, we'll move on to the physical examination. I'm just going to have the patient remove his shirt, so we'll start off with the inspection. First, we're going to note shape and symmetry of the chest and the lungs. There's good symmetry between both sides. There's no abnormal noted masses or any growth abnormal to the chest. The front and the back look good, side to side, shoulder to shoulder look good and symmetrical. The bony framework of the chest is obvious. You can see the contour of his chest and his belly. You can see the different parts of his body and make out, his shoulders and his chest and his belly. There's a good angle to the ribs going down. The sternum is rather flat and free of any abundance of overlying tissue. The patient does appear to be adequately able to have CPR performed on him or life-saving measures. He's not morbidly obese. You can mark certain angles on his chest. You can see his trachea's midline. He has a good clavicular notch, the sternum and the xiphoid process, and the angle of Lewis. The anterior and posterior diameter of the chest is less than the lateral. There's no kyphosis, lordosis, or any obvious mechanical disadvantage that would inhibit the patient from breathing mechanically well. The trachea is midline. The skin has good color and texture. There's no noted clubbing of the fingernails. Good fingernails. There's no obvious noted clubbing, no cyanosis or blanching. Next, we're going to observe for respirations, rate and behavior at the time he's sitting here. Rate is about 16. He shows no obvious distress, effort. It looks effortless for him to breathe. He's not struggling to breathe. There's no obvious accessory muscle use. There's no retracting substernally or belly breathing. There's no heaving noted. His chest movement is symmetrical on both sides. His chest expands on both sides. It's not shallow or deep. He is able to meet his demands adequately. There's no noted obvious audible breath sounds. There's no noted obstructions to his mouth or his nose, inhibiting him from breathing. There's no growths or anything to his face that would also inhibit him from breathing. There's no noted nasal flaring or any retractions. The smell from there's no obvious odor coming from his mouth or his nose. There's no obvious nasal drainage drooling from his mouth or anything like that. And there's no noted obvious superficial venous pattern to his upper neck or anywhere to his chest or any JVD or any spidery veins that would warrant long-term hypoxia or any type of heart failure that would also inhibit his breathing. We're also going to inspect the thoracic shape and condition. No pulsations or bulgings in the chest or any depressions. The trachea is noted, substernal notch, clavicular line, the angle of Lewis, and C7 and T1. There's no obvious neck injury or anything mechanically inhibit him from breathing adequately. Posture is good. Patient is able to sit up in the chair. He's independent at home, is able to ambulate and walk around, so mechanically no obvious arthritis or ambulatory dysfunction, neck or back trauma that would warrant him to unable to sit up or stand or tolerate, so that he could fully expand his chest adequately to breathe to meet his needs. Next, we're going to move on to palpation. We're going to palpate for any pulsations, areas of tenderness, bulges, depressions, masses, or any obvious lymph node enlargement or anything, or also crepitus. So we're going to palpate his chest and his lungs and his neck. No obvious noted lumps or bumps, any tenderness. No bumps, no pulsations. I'm going to have you lift your arms up. No lymph node enlargement or anything in his neck for lymph node enlargement that would warrant for any possible bumps or lumps or abnormalities. There's no depressions or masses. His sternal line is good.